I think it's fair to say it was a relatively quiet ASH for Hodgkin lymphoma this year, but there are some, continue to be developments in the field, which is always welcome. It's largely all about checkpoint inhibition still. So, we've had checkpoint inhibitors for a little while in Hodgkin now. They're very effective. And it's all about trying to find where they're optimally used. And at ASH, we had an interesting presentation of Pembrolizumab combined with ICE for patients with first relapse. Now, we have already seen Pembrolizumab combined with GVD presented, very high response rates and CR rates. However, GVD is not a hugely used regime, certainly in the UK. It's quite difficult to get hold of, particularly one of the chemo components in that regime, whereas ICE is pretty standard. So this was a very welcome presentation. And again, it showed fairly similar outcomes, very good response rates, no impairment of stem cell collection, high number of patients going on to an autologous stem cell transplant with a really good and durable high PFS. So I think, if we were able to use a PD-1 inhibitor in combination with chemotherapy in first relapse, that would be a very good place to use these drugs. That the problem is we don't have a randomized trial, and therefore there's no license, at least in Europe, to cover the combination of a PD-1 inhibitor with chemotherapy. So we really do hope to see a randomized trial in that particular context.